Hi, everyone. My name is Tiffany Vincent. I am 34 years old from Baton Rouge, Louisiana, and I have classic Ehlers-Danlos syndrome. And today I will be talking to you a little bit about my life and experiences with this. I was very blessed to receive an early diagnosis at the age of 5. This was done by a skin biopsy. As a child, I displayed very typical symptoms of classic EDS. This included easy bruising, easy laceration, laxity in joints, recurrent dislocations, very soft and stretchy skin. The pictures on the left are just bruising from simple falls and the bruising and lacerations. And the picture on the right is from a fall down one flight of stairs after accidentally being run into. I was very lucky to attend a school that supported this diagnosis and was proactive in educating my classmates on how to try to be a little more careful and mindful around me. Each year they would take like a simple sheet of paper and be like, "This is your skin," and it wouldn't rip. And then they would take a Kleenex and be like, "This is Tiffany's skin," and it would rip. And they'd be like, "Whoa." So this really helped to remind everyone about my condition. I would say that my most difficult complications from Ehlers were dermatologic and orthopedic related, but I do have other issues in GI and cardiac and dental secondary to Ehlers-Danlos syndrome. I've always had symptoms of POTS or postural orthostatic tachycardia, but this was very difficult to diagnose and took many, many years and a long time to figure out. Now that I'm older and educated on it, I'm able to manage that very well with diet and exercise. In 2010, I encountered my first major orthopedic surgeries due to Ehlers-Danlos syndrome. My feet always suffered the most from the joint laxity, carrying the body's weight. My ankles constantly rolled out of socket, and this was very painful. It really limited my ability to walk. So I underwent a triple orthodesis of both ankles, which is a fusion, and a lapidus bunionectomy of the forefoot to realign it. The picture in the center is before, and the two on the left and right are after with the hardware. And the picture at the bottom is my footprints before on the left and after on the right. This was very scary. No one knew if the metal would really be able to take or if my joints would be able to support the implants. So it was kind of a big leap of faith. But my MD was amazing, and my recovery was very lengthy for each surgery. And we were very conservative with the transitions between like wheelchair and crutches and weight bearing. But we did recover, and this allowed me to sustain my ability to walk and move on to complete my education and travel and get married and participate in things like medical mission trips. In 2020, at the age of 34, I encountered my second major orthopedic surgeries. I suddenly kind of had this really acute pain in my right hip and was unable to bear weight on it. So we kind of discovered that I had AVN of both hips. This was not steroid induced, or actually some of my MDs believe this may have been related to trauma from recurrent dislocations, injuring those very fragile arteries to the hips. So we tried the cord decompression first, and unfortunately that did not take to the right hip. So we opted to replace both hips at the same time. And this was a very lengthy and difficult recovery, but we made it. The pictures on the left are my scars at 4 weeks and 6 months post-op. And the pictures on the right are from blood transfusions. I just bruised so easily. And the bottom one is actually from crutches, even with extensive padding. I've done a lot of strength training to really regain that muscle. And the more I strength train and strengthen those muscles that surround all of my joints, the less I have to rely on my joints. So that has been significantly helpful in recovering. I would say that with both surgeries, all of these surgeries, my recovery as a patient with EDS has just been lengthier than your average patient. But I was still able to support the implants, and this has all allowed me to sustain the ability to walk and keep an active lifestyle. These are just videos from the left video is using an Ultra G anti-gravity treadmill in therapy after the core decompression. This was very helpful. And the video on the right is coming home from the bilateral hip replacement. My gait is just very stiff, which this is now no longer the case. While these surgeries have certainly made my range of motion less, it has provided more stable joints to allow me to stay active. And this is me today. I was always surrounded by an amazing team of specialists my entire life. And this inspired me to study and practice medicine. So I'm currently an ENT, a physician in ENT head and neck surgery. I practice in the OR and clinic settings, and last year I was able to assist with our larger COVID surges. I would like to inspire other patients with Ehlers-Danlos syndrome that you can do anything that you put your mind to. I just sometimes have to do things a little differently, and that's okay. I would really like to emphasize to the medical community to provide an early diagnosis or as early as possible, because this can help with prevention of complications, for a better prognosis of the patient and a higher function and quality of life for our patients. And that's really my goal whenever I try to advocate for EDS patients. And that's it. I would like to thank you guys for this opportunity, and I hope that I provided a little encouragement and hope for our Ehlers-Danlos patients.